IPM working group. The Public Tick IPM working group is funded by the USDA National Institute of Food and Agriculture Crop Protection and Pest Management Program through the North Central IPM Center. On today's agenda, we have ticks and tick-borne diseases in Wisconsin and the role of the Upper Midwestern Center for Excellence in Vector-Borne Diseases. That's a presentation by Dr. Paskewitz and staff. Afterwards, we have an IPM Symposium Tick Summit, Capitol Hill visit, and also a poster update. And lastly, we'll have additional updates, comments, and announcements from working group members. So, without further ado, we'll move down to the first agenda item. Susan runs, so that's the presentation for today. Susan runs the Medical Entomology Laboratory at UW-Madison, where she teaches and conducts research on local and global health impacts. She has extensive training and experience in zoology and entomology, including a master's and PhD, respectively. Today, Susan will discuss the role of the Upper Midwestern Center of Excellence in vector-borne diseases, particularly in Wisconsin. Please follow along with Susan's presentation on the screen, or if you called in and can open the PDF slideshow that I sent to the group yesterday and today, you can follow along with her presentation there. Without further ado, I'll hand the floor over to you, Susan.
Thank you, Frank. Hi to everybody from Wisconsin, and I just wanted to mention to you that I also have in the room here Dr. Scott Larson, who's responsible for a lot of our upcoming projects on tick management, Dr. Binika Braun, who's participating in that, as well as in the tick app, which I wanted to talk about today a little bit, and Jordan Manley, who's a PhD student with me, who has been doing a lot of the work on the integrated tick management project over the last 4 years now, that I'm going to talk about at the end of the slides today. So let's see, I can make my slide move. Let's see. Oh, there we go. Okay. So, you know, like Frank, I have to start my presentation today just by thanking the people who provided support for a lot of the work that we do here. We do a lot of ecological projects as well, but certainly we've had great input from our Wisconsin Department of Health Services, have provided a lot of support for much of the surveillance work that we've done over the years. The USDA has provided the support for our current integrated tick management project. And then the CDC, that I'm going to talk about a little bit in a minute in terms of the Center of Excellence support, has also provided resources going forward. And then too, before I tell you too much about what we've been doing, I never want to forget that we couldn't really do this work if we didn't have an extraordinary team of graduate students and undergraduates in particular. So we always have a team of 8 to 10 undergrads who help us every year, and you can see some of them here. I'm the person in pink, in the pink shirt in this slide if you're following along, but you can see everybody is still smiling after a really long day pulling buckthorn. So we couldn't do it without our team, and I have to remember to acknowledge them. So I also want to put this in the context of the Upper Midwest, in particular, maybe reminding the group that so much of the work that's done on tick-borne disease is really centered in the eastern part of the U.S., and much less attention has been paid to the issues in our part of the country. But we have a very serious problem with tick-borne disease here, and it's not a static problem. You can see from this map that Becky and Lars Eisen published recently that illustrates the huge changes that we've seen in the distribution of Ixodes scapularis in the Upper Midwest. And of course, you know, my team and I are really centered in Wisconsin, and so you can see a lot of change in where ticks are established now in Wisconsin just in the last 20 years. But you can also look out into Minnesota and see the issues there. You can look over now into Michigan and see the expansion, especially into the western part of the state. Look down into Illinois and see problems occurring there, and even in parts of Iowa where they didn't used to have to worry about these ticks. So we're seeing huge changes in where ticks are, and I would say in Wisconsin now, pretty much if the habitat looks right, everywhere you go, these ticks have managed to establish, and that's really different from when I first arrived here in Wisconsin back in the early 1990s. So along with the change in where we see ticks in our part of the U.S., we also have seen a major increase, of course, in the diseases associated with ticks. And this is a figure from our Wisconsin Department of Health Services. So again, what you see here is what I think people are seeing across the country: big increases in the number of people who are being affected by and afflicted with these disease agents. In particular, here is our 20-30 year statistics for Lyme disease, and you see total over that period 41,000 cases of disease. I'm sure this audience doesn't need to be reminded, but that's just the reported cases. That's not the actual numbers of people who get ill. There's a huge amount of underreporting for Lyme and for other tick-borne diseases. But again, just to make the point that we've seen big increases here, at least threefold since the early 1990s, just in the reported cases. And the other thing that's interesting about our region, I think, is that we have tended to be a hotspot for new pathogens. Maybe this group knows, but maybe not, the first case of Lyme disease, at least that I'm aware of, that was reported in the literature, was a case from Wisconsin in the old Scrimenti paper, and it was somebody who got sick in 1969, and he published what was very clearly an EM rash in his paper in 1970. And then, I put this timeline together to remind myself when, how much has happened just over the last 20, 30 years. But I was involved in those early studies in Anaplasma phagocytophilum when Johann Bakken up at the Duluth Clinic noticed something strange in the blood of some of the patients he was seeing. Since then, just in the last decade, we've seen a number of other things that had not been known to make people sick before. Leishmaniasis was one of them. Just recently, the new Borrelia mayonii. We've now also reported our first cases of Borrelia miyamotoi, and then just this year, and not in Wisconsin, but in Michigan, the first human case of a Babesia divergens-like pathogen. So we have seen a lot of new things emerging here, and I attribute that probably to the Bobby Pritt at the Mayo Clinic, because Bobby has a wonderful staff and is very alert when they see things that don't quite match up in their diagnostic assays. And so we've worked quite a bit with Bobby on looking at some of the new things that she's discovered there. Another reason why we may have a hot spot for emergence here has to do with the way our ticks are different from ticks on the East Coast in terms of the synchrony in when larvae and nymphs occur here. So in general, what we tend to see is larval and nymphal feeding peaks or questing densities peaking in June, sometimes into early July in our area. So they're out there and they're feeding on their reservoir hosts at the same time, which is quite different, I think, from what's been described from the East Coast. So we've seen a lot of new things. For the most part, thank goodness, these do tend to still be pretty rare. Most of these are not diseases where we see a lot of cases in the human population. Anaplasmosis, however, is becoming increasingly common in the state. And so now from this figure, you can see, 500, 600, 700 cases every year. I don't think it's very clear whether that's an underestimate or not, but I wouldn't be surprised. So this is one that we're definitely concerned about. Well, with that backdrop of a lot of disease and a lot of change, one of the things that we've tried to do here is to provide a resource for the public who are very interested in these, in the ticks themselves, but also, of course, in the disease agents, a resource for the public, for patients and for clinicians, so that they can have a place where they can go and look at the current knowledge about distribution of the ticks. We try to provide some information about the prevalence of the different disease agents in ticks at this website. And, you know, we started doing this in part because we were hearing from patients that they were being told by their doctors that there weren't any ticks in their areas, so they couldn't have Lyme disease, for example, or couldn't be infected with anaplasma. I think that reflects the fact that originally, you know, 20, 30 years ago, the ticks really were much more abundant in the northern part of the state and in the western part of the state, and it takes a little while for the medical communities to realize that change has happened. And now, again, you know, everywhere you look, you're going to find them. So this is the resource that we provide for the citizens in the state. The one piece of this that I'm hoping as a result of the support from the Centers for Disease Control is that we're going to be able to improve the section on protection and management of ticks. So personal protection, what can you do around your own home? What are some of the things that work? I have another site that's a Wisconsin mosquito site, and I provide a lot of information there about which of the different tools that are available to you actually work, and try to give the science. Actually, I provide the evidence and the references for if you're going to have bat colonies in your yard, is that going to actually work to reduce your biting pressure from mosquitoes? So I'd like to do something similar here for the ticks, and we'll be working on that over the next year. So the next thing I wanted to introduce you to is the Midwest Center of Excellence for Vector-Borne Disease. And this, I know that you've heard already from the folks from at least the Northeast Center, who we share a lot of common interests with. Our center, of course, has a major focus on tick-borne disease, as well as on mosquito-transmitted viruses, in particular on West Nile virus and on some of the California group viruses in our area. Our center is truly a regional center, so the administrative core is here at the University of Wisconsin. It's directed by myself and by Lyric Bartholomew, and Lyric is in the School of Veterinary Medicine, but she's also a medical entomologist, formerly the med ent person at Iowa State, but we were lucky enough to be able to hire her away. So she and I co-direct the center, but we have great partners in Minnesota, great partners in Iowa, in Illinois, and in Michigan. And so those 5 states are the initial founding partners in this Midwest Center of Excellence. I would say that on our tick-borne projects, we probably have things going mostly with Minnesota and with Michigan, a little bit in Illinois as well. And I think it's been really useful to all of us just to be able to talk back and forth about what we're seeing in each of our own domains, and to share resources and information. One of the things that we've been trying to do with the center is to enhance our surveillance. And so I think that Jean Sal, for example, is doing some of this work through Michigan, and I think that she had ticks now in 6 places as a result of her activities this year, 6 counties maybe where they hadn't been seen before. One other thing that the center has been trying to do is to have all the partners standardize their surveillance methodologies, so that we're all using the same kinds of tick drags and dragging for about the same amount of distance and time and all of that, so that we can do a better job of comparing tick abundance across our region and understand when we're seeing some important differences. So on this slide, this is the research and innovation slide. I just listed the major goals on the research side of our center. We have training goals, and then we have working with the public health community to improve surveillance and responses, but we also have a series of research goals as well. And those goals I would describe as trying to find the edge and discover new things that we can use against either mosquitoes or against ticks, to respond to anything that emerges during the time when the center is in operation. And so I just described a number of new things that have happened in the past, and we want to make sure that we continue to work on anything else that comes up in the near future. Along that line, one of our associates, one of our students, is working on a project to look at the virome of ticks in the upper Midwest to see if there may be some potentially infectious agents in those ticks that we haven't recognized before. So hopefully at a future meeting of this group, I'll be able to talk a little bit more about some of the novel things that we're working on, as well as these viruses that we're investigating. The other two things are to focus on the integrated tick management approaches and testing those very specifically in the context of the upper Midwest. Again, I've described some of the differences with the tick biology that we see here, and we do have a different rodent community as well that may be important in some of those applications, some of those strategies. And then finally, our other major goal on the tick side anyway is to look more at the human behavior and how that is impacting interaction with the vectors and exposure risk. And so that's Dr. Braun's work, which we'll talk about at the end today. So one of the things that I think maybe we're more aware of this than other people are, but there's really been almost nothing done on tick control in the upper Midwest. We just have very few studies that we can reference or provide as evidence when we're trying to give advice to homeowners, for example, who may want to know what they can do in their own vicinity. So we really rely very heavily on work that's been done by, for example, Kirby Stafford, with his great manual on how you might manage the landscape around your home. We rely really heavily on the outcomes of some of the acaricide sprays that have come out of the East Coast, as well as all the work on the bait boxes or the tick tubes that have been published there. So whether those things would work here in the same kind of way that they work in other parts of the country, I think isn't very clear. Certainly some of these things we don't even have very much information about from other parts of the country. So looking at landscape management, for example, there's not a whole lot of published literature that suggests that if you make these changes, you're going to reduce disease. We have also been having a lot of conversation, as I'm sure many of the people on the call have been, about the recent study supported by CDC on the barrier spray treatment, which didn't seem to have very much impact on human disease. So there's clearly a lot more work that needs to be done to understand when and where integrated tick management is going to be effective. The other part of what we've been thinking a lot about for our center grant is how to get communities involved and neighborhoods involved in trying to protect themselves. And we know that there are things available to them that they could go out and get, even without establishing a major mosquito abatement district-like format to implement these on a community basis. But neighborhoods might be able to do things together. And so Dr. Larson in my group has been working with a couple of communities that are very interested, that they actually came to us and asked for some advice on what to test and try. And so we've been looking at some of the things that they might look at, and hopefully we'll be able to, test these in that kind of a context, and then provide recommendations on what a do-it-yourself toolkit might indeed have to look like. So some of the things that I just talked about, we have done a little bit of work in Jordan Manley's project here in Madison over the last few years. And what we wanted to do was to look at what would happen if you tried an integrated strategy. And we decided that because there was not much known about how landscape manipulation would function as a tick control method, that we would use that as part of our integrated strategy. And there we were really thinking about the relationship between some invasive plants and tick abundance. And so there has been some really interesting work, for example, on invasive honeysuckle and Lone Star ticks that was done by Brian Allen and a colleague of mine here at UW, John Orrock, where they showed that honeysuckle had a big impact on the abundance of ticks at a very focal kind of scale. Similarly, Japanese barberry on the East Coast has been associated with higher populations of Scapularis. And in our own area, we have unpublished information that would suggest that buckthorn, which is a very invasive plant, a little tree or a little shrub here, where buckthorn is denser, we also tend to find a relationship with higher populations of Ixodes scapularis. So we decided that our landscape manipulation would be to try to remove buckthorn. It's kind of a twofold idea here. One is that it's a restoration of a natural landscape because it is an invasive plant. So it gives us that aspect that's from a conservation perspective, as well as the aspect of tick control. So we decided we would remove the buckthorn. The idea is that without the buckthorn, perhaps the environment is more open, so you get more sunlight penetrating down to the leaf litter. It may be open and also not as attractive to the mice, the major host and reservoir for Lyme and for ticks here. But that was something that we hadn't tested. We didn't know what the answer would be. So we removed the buckthorn. And then we combined that manipulation, which we anticipated would target the off-host ticks, the questing, especially the immature stages, by making the environment less hospitable to them. And we combined that with a host-targeted methodology. And so we decided to use the tick tubes, primarily because they're a little less expensive than the bait boxes, and it was something that we could implement ourselves. And so Jordan actually made his own tick tubes using some PVC pipe and treating cotton balls with permethrin and then deploying those in our plots each year. So again, the idea was that we would target two different stages, and primarily we're shooting for larvae, you know, as a major way to reduce the density of the questing nymphs in the environment. And so we're hopeful that if we get rid of the buckthorn and make the landscape a little drier, the larvae won't do very well, and also that any larvae that managed to get on the mice would then be killed before they could get a complete blood meal, get infected, and then turn into a nymph. So, oh, you know, I was going to say one other thing right there. I'll tell you in just a second, this next slide, about our methods and how we set the trial up here. But I did want to mention that the tick tube, we're aware that there have been several studies of this already on the East Coast, the permethrin-treated nest materials, and that those came back with conflicting results. So a couple of those studies in Massachusetts looked very promising, where the reduction in the density of nymphs was just striking. And then several other studies in other places didn't look very good, where very clearly they didn't see a strong reduction at all. And why that might be, you know, not entirely clear. It could very well be that there's a difference in the animal communities between those locations, and that if you're primarily a mouse-driven system and you don't have a lot of shrews or other things that could be feeding ticks, maybe it works okay in that environment, but not so well when you have lots of other potential hosts. So we wanted to test this in our own space and see what the outcomes might be here. So this is the description then on the method slide of what Jordan's project ended up looking like. So he did it here in Madison, and he had, gosh, was it 17 different sites, and they're about half-acre plots. Each of the plots that receives cotton balls gets about 25 cotton balls across the plots. Another subset, so in that case, I think 4 of them get treated like that. Another 4 have the buckthorn completely removed, and then 4 of them get both the buckthorn and the tick tubes as a treatment. And then we had another 5 locations that served as control plots that weren't treated at all. And each of those then was assessed for questing immature stages at multiple times throughout the summer. So I think he was going at least once a month. Is that right, Jordan? Yeah, at least once a month for doing the questing nymphs. And then he also trapped animals and was able to get an assessment of how the treatment impacted the body burdens on the rodents. Did I forget anything there? Anything important? He's shaking his head. Okay. So here on this slide, this is the money slide. This is the slide that shows the results of the 2 kinds of treatments over the 3 years. So the first year that we deployed was in 2014. And you wouldn't expect to see much of an impact of the permethrin on anything that year. You might see a little effect on the density of nymphs if you made the habitat less hospitable for nymphs in the buckthorn removal, although we didn't expect to see a lot there as well. The next year in 2015, for whatever reason, we had a huge boom in tick density. So we just had, that was our most abundant year, but you could still see, even with that big increase in the populations, you could still see significant impacts on the density of nymphal ticks, questing nymphal ticks in all 3 of the treatments. In 2016 and 2017, what we saw was that the buckthorn, even though we continued to remove it in those years, it stopped working. We didn't really see much of an impact. So that idea that opening up the landscape and making it a little bit drier, or that the mice just wouldn't really use that kind of habitat, that does not seem to be true. We're thinking that maybe in 2015, what happened was there was so much buckthorn in there that it was a major disruption of the whole leaf litter. I mean, I think I have a picture earlier, you can go back and look at it, but it was extremely dense. So it was a huge change in the landscape. In subsequent years, we had most of it removed. So it was really more of just a touch up. And once we did that, as you can see from the data, we just didn't see much of an effect from the buckthorn. We did, however, see a persistent effect and a decrease in the density of nymphs whenever we have the cotton balls out. And I didn't put a slide in here, but one of the things that we've noticed when we're looking at our animal data is that we have really good reduction in the infestation of animals in July and August, but not very good in June. And I think it's because of the way that we have designed it. We've designed it to be able to use our undergraduates who don't get out of school until the middle of May. And so what we've had to do is deploy our cotton tubes I think too late. And so this year, what we're going to try to do is get the cotton tubes, the tick tubes out a little bit earlier, and hopefully maybe even as early as April or even March. I mean, it depends a lot on when the snow goes away here, but we will try to get the tubes out earlier and then take a look and see if that might have a better impact on the immature burdens on the mice at the earlier stage. If that turns out to be true, then we're probably going to want to try some early deployments and see what that does to density of nymphs in the following year, just to see if we can get a little bit stronger of a reduction. But, you know, at this point, then what I would say if someone in the public asked me was that it's worth trying the tick tubes. And I would also say that, at least in our context, and I would also say that it's not worth the buckthorn removal. That was the hardest part of what we did for this particular study. And it just doesn't look like it really made much difference. So, you know, I think our next steps will be to continue to test the tubes and see if we can make them work better with some different deployment strategies, and then to be thinking about what other kinds of things we may be able to use in combination. So perhaps some of the treatment of the landscape with natural acaricides. Something one of our partners is working on. We've also talked about trying to use some of the over-the-counter pesticides that are available. You go to Home Depot, you know, and pick up something and take it and spray. And where we can find communities that would be willing to do that, we're happy to test that as well. But we are finding in conversations with our homeowners that many of them are not that interested in applying that to their properties, which I think is something that people, you know, that probably happens everywhere, that there's a subset who would be willing, but many more who would prefer not to. So, and then one other issue for us that comes up when we're talking about trying to apply pesticides to the yard is many of the groups that we're working with up north are lakeshore communities, and so we have some restrictions, of course, on how close to the lake edge we can get in applying any of these chemicals. So let's see. Then the other thing that I wanted to talk about was the study that Dr. Braun, Bineke Braun, has taken on. And so this is a study that is going to attempt to get at some of the aspects of how people are actually picking up ticks, what they're doing when they're being exposed, and thinking about if we had more information on that, how we might target our, of course, our educational materials for the public. The origin of this particular project was a result of a conversation with Maria Duke-Wasser, who's in the Northeast Center at Columbia, and her postdoc, Pilar Fernandez. Thank you, Bineke. And so Pilar and Bineke have really been the drivers here, have spent a lot of time thinking about how to do this, and they've come up with this idea of an app that people would be able to download, and then would provide access to a survey. So people would take a pre-survey about what they tend to do in a given summer, what their property looks like, whether they have pets, you know, demographics, that kind of thing. And then during peak tick season, which for us is probably going to be in June, they would agree to get pinged every day with a reminder to do a daily survey. And then if they find a tick, we'd have them report the tick, and then try to inform us about what they think they were doing when they picked the tick up. We also are going to build in functionality where they can report a tick at any time. So if they're doing something and they find a tick and want to let us know right then, you know, they know exactly how they got it or where they were when they picked it up. We think that that will be a useful functionality. And you know, there are other aspects of this, but primarily just the idea is to try to get at, you know, where people are being exposed. Ultimately, I think we'd like to assess whether we can use this kind of a tool to prevent disease by just reminding people, either through a text message, a daily text message during the peak periods, you know, in June when people are most likely to be exposed to nymphs anyway, just reminding them to do their tick checks, or perhaps some kind of a social media interaction where communities begin to talk to each other when they're starting to find ticks on themselves. But we're not going to be doing that this year. This year, we're primarily going to focus on our risk factors and comparing those here and with Maria's study areas in the Northeast. One of our questions, and for a long time, has been whether people here are primarily getting exposed when they go out recreationally. So we have tremendous amount of fishing in the summer, for example, and maybe that's not as true in the Northeast. Maybe in the Northeast, people are more likely to be exposed in their own backyards, although at this point, we've done enough collections in people's backyards so that we know that they certainly can be exposed in those places as well. Tick densities are quite high in a number of homeowner properties that we've looked at. So, so anything else I should say about that, Bineke? Is that covered? Okay. Well, she and Scott and Jordan are all here to answer questions if people would like to know more about any of these things. So with that, I'm going to end it, and we're happy to have more conversation.
Great, thank you very much, Susan. Just a reminder to people who have questions, since this is our first go-to meeting, you may have to click on the microphone to unmute yourself before you're going to be able to ask that question. With that, I'll go ahead and open it up.
Hey, Susan, this is Tom Mather from the University of Rhode Island. How are you?
I'm good. How are you, Tom?
So I have a question. If your phenology of your ticks, your larvae and nymphs are kind of synchronous, I guess I'm a little, I mean, it would seem to me that with the tick tube technology, you'd be killing most of the ticks at the same time.
That's what we hoped. Yeah, that we'd be getting both the larvae and the nymphs on the animal at that time. And so, you know, the nymphs might be out just a little bit earlier than the larvae are, or they may be, we're killing them too, then those animals are not going to be getting infected. Usually our nymphal densities are a lot lower than our larval densities on the animals. So, if nymphs aren't feeding or they're getting killed, then those animals aren't going to get infected. So hopefully any other larvae that are getting on them, after that may also be less likely to get infected. I think,
but you mentioned,
I don't think we finished looking at our infection rates yet, though, in the animals. So, yeah, I could let you know.
but you mentioned that your sampling went on in through July and August. So the larvae and the nymphs co-occur all through there, but the peak is in June.
The peak is in June, although I will say that it varies a little bit. Sometimes we see them peaking into early July. It depends on the year. Early July, we can still see a fair number of them, and we do still see them into August. Here, once in a while, we'll get an odd pattern where we do see larval peaks, or maybe, I don't know if I want to call it peaks, it's bimodal, so we'll get a lot of larvae in June, but then we'll also get a lot of larvae later in the season, again in August.
It's interesting.
Yeah, I think, I believe that if you go up to northern Wisconsin, you don't see that. I think that's a southern Wisconsin, this bimodal issue, where some years it's a higher peak in the late summer for larvae, and some years it's just really clearly in June. I don't think that happens up north. I think up north it's June. In June it's larvae and nymphs.
Thanks.
Okay, do we have other questions at this time? Also, Susan, do you want me to stop sharing your screen? I think if you go to the screen tab, you can choose to stop.
Okay.
On it, yeah. Or I can take it back from you too. Oh, there we go. Perfect.
Hi, this is Monica White from Colorado Tick-Borne Disease Awareness Association. And Dr. Paskewitz, I just wanted to say thank you so much for allowing me to use some of your photos from your website. Your website was one of the first ones I located when I was developing our resources here in Colorado, and I find it to be extremely helpful. So thank you very much, and thank you for your presentation today.
Oh, well, thank you. Appreciate that.
Okay, well, if there are any other questions that come up later, I'm sure you can shoot me an email and I can forward them to Susan and her team, and I'm sure they'd be happy to give you an honest response. So